C-reactive protein is the best established inflammatory marker when looking at risk of cardiovascular disease, particularly myocardial infarction. You know, if you order a C-reactive protein in a hospital, it will give you a range for risk of, high, low, intermediate, with regards to cardiovascular disease. So it's something that has been well tied to that. Also tied to stroke, although I don't think that research is as robust. But it is one of the well-established inflammatory biomarkers. The reason I thought it was interesting from the point of view of migraine is that many have, through their research, implicated inflammation in the pathogenesis, the cause or consequence of migraine. So it's somehow related to migraine when they've studied it both in animals and in models of migraine in humans, that there are these inflammatory cytokines that get released probably when CRP is released into the brain to cause migraine. And the question is how useful is this in a human population of establishing being able to actually draw blood, find a marker, and maybe not make a diagnosis of migraine just based on a marker, because this is a non-specific, and everyone has a level of some sort, but whether it would be helpful in persons that have migraine if we get a C-reactive protein level that's elevated as to maybe figuring out best treatment options or their risk in particular for having a stroke or myocardial infarction, since we know those are linked with each other. This patient population, it came from a study that is a national longitudinal study of adolescents, and it's called the short name for it is the AdHealth database. Now, it's not part of the study or the study design, but this is a database that, with permission, is available to be used by researchers, and we've been doing a number of different research studies using this database. And one of the things I had been interested in and had looked at in smaller populations was C-reactive protein. And we had gone ahead in this population, and these were people that were between the ages of 28 and 32 years old. The average age was, I think, 29 something, months, and both in the migraine and the no migraine group. They had been in the study since they were anywhere from 7th grade to 12th grade when they were enrolled, and then every so many years they follow up with this population. I think they're now on the 5th wave, but so these people are now up near 40. But when we studied them, it was what we called the 4th wave of the AdHealth study database. The primary findings were that in this population, that C-reactive protein was elevated in persons that had migraine compared to the no migraine controls, and even after controlling for many different factors that that can have an impact on this concentration. And those are things like not just age, but these are all people within a same age group, but also things like weight. If a person has a higher weight and BMI, then that's more inflammatory tissue, and they are going to have a higher level. We looked at sex and race. We found it was higher in women compared to men by quite a bit, just in the population. But also if they had had a recent infection, if they were taking non-steroidal drugs, we had to control for all those different things. And we found that the people with migraine had higher C-reactive protein than those without migraine, and that it was particularly robust when we looked at just the female population, when we controlled for all those things, that in females it was higher than in the females without migraine. I think it is really more of just some more corroborative data that migraine is related to inflammation, and it opens up, I think, ideas for pathways to varying treatments and additional treatments that might be helpful if we can figure out who's at risk. Now, unfortunately, in this study, we don't know. This was all physician-diagnosed migraine per patient self-report, but we have no idea were these migraine with aura, migraine without aura, and that might be important. There had been some other studies, small studies, many of them have suggested this, so this is not new from that perspective, but looking at population-based studies, there've really only been a few. So one was in children, and that did find that C-reactive protein was associated with migraine, or headache, actually it's headache in children. That's the NHANES database, which is a large nationally representative sample. And then there was another study that had looked at, it was a women's health study, that had looked at it in women age 45 years and older. So that was only women, and they had found that there was an association with migraine. And again, they weren't able to differentiate migraine with and without aura. I don't believe in that study. And then there was a large Icelandic, the Reykjavik study, that had looked at big populations. And they had not found that there was any difference in migraineurs compared to non-migraineurs. But if you looked at the subsets, which they did in their paper, the young women were the group where at least they saw a trend. It was almost significant p-value, but it looked like they were higher in that subgroup. But it was mostly the migraine without aura, which is interesting because that is not supposedly the group that's at highest risk of stroke. So whether this, is something that can at least help us distinguish which of our migraine patients have a higher risk of stroke and should maybe be on something like a daily aspirin. I think that that's research that's yet to be done, but I think it's very intriguing because there's probably pathways open to help prevent migraine, but also to prevent the cardiovascular and cerebrovascular consequences of migraine. This one in particular, not sure where I would want to go next with this. I had looked at it in smaller populations, and one thing that we had looked at was we had found a very tight association in a group of premenopausal women with C-reactive protein and the Adverse Childhood Experiences questionnaire. So I had gotten lots of different biomarkers in a population of 125 young women compared to 50 aged sex-matched controls without headache or migraine, and we had found that C-reactive protein was elevated in the migraineurs, and particularly in the migraine with aura. But then we just sort of took the group as a whole, administered questionnaires about their early life experiences, because those have been tied to increased inflammation in adulthood. And we found that there was a very tight correlation, but we haven't looked at that data in this population, so that might be something that's very interesting to do as well.